so I apologize for the ATLians who have to. This is Darnell's. He's trying to play DJ. That's the Roots, right?
That's the Roots.
All right, so he, we Southern bound here on this show.
You better get Sturgis in here.
I know the Roots are cool. All right, so in the studio, ladies and gentlemen, highlighting great people doing great things. My good friend, my personal doctor, Dr. Courtney Russell Jr., the gangster doctor. And when I call him the gangster doctor, it's because he do gangster stuff in the neighborhood. I'm so serious. So he's out in the Bluff, my old stomping ground. He does a lot of community work. This guy goes into the trenches. No, he doesn't just go into the trenches. He really lives in the trenches. This isn't what he does outside of. This is what he does because of his care for the community. He has a program called A2H2. We've talked to them before. They got something coming up called Changing Healthcare. Let's talk about this.
Yes. April 22nd, we wanted to address this issue of healthcare because it's a reason why poverty is perpetuated. How can you expect to come up out of poverty when you're not feeling well and you have no hope of feeling better, because that's not an option for you, given what your priorities are when you're in poverty.
Let's talk about health for a moment. Let's pause at that place. We had the Affordable Care Act, a.k.a. Obamacare.
Yes.
We then had something else proposed, which seems like the Lack of Care Act.
Yes.
How would you classify this as a medical doctor? How do your colleagues classify this?
It's terrifying. When you have over 20 million individuals that will lose health care, that's not what we signed up for. That's not what I signed up for. Healthcare should not only be for the individuals with options, it should be for those that need it the most. And this healthcare that's being proposed right now is filled with cutbacks, is more of a business move versus a life choice and a betterment of individuals' lives. Because whether or not you voted for Trump, you voted for Hillary, at the end of the day, the ACA really benefited white Americans.
Yeah.
And so
white females specifically.
Exactly.
Right.
Just by the numbers alone, more white individuals are in poverty versus black individuals. We're just highlighted and we're just exploited to see like we are the face of poverty when we're not.
Now we're seeing some of that. There was a news report last week that I saw, and these guys, this was an all-white town, very poor, very old, very sick.
Yes.
This was considered the sickest town per capita in the United States of America.
Wow.
And many of them had lung diseases. They went on record. This reporter grabbed this story. All of these people went on record about how the Affordable Care Act has helped them.
Yes.
How the Affordable Care Act caused them to now be able to afford insurance. So the population is getting healthier because of ACA.
Yes.
Now, they're upset at Trump, and rightfully so, because he's taken away some of these provisions based on Trump care. But the irony is every single one of them on the camera voted for Trump.
Of course.
Every single one of them.
Yeah.
And I'm wondering, did you not hear him when he said this is what he was going to do?
As we are right now, I tell a lot of people, why are we surprised that the divisive nature of the country is what it is right now? He told us what he's going to do. He told us exactly how he's going to act, and he got elected. If anything, he's being honest.
Yeah.
He's not doing what politicians do. He's actually doing exactly what he told America he will do.
Yeah, that's the thing. Like, this should be a shock to anybody that he's doing it. And when people, I disagree with him, and I disagree with him when he proposed it.
Of course.
So, of course, I'm disagreeing with him now that he's doing it, right? But there are people who agreed with it, so they voted for him, and now they're like, what the hell is going on? He said he was going to do this. All right, tell us about specifically your program.
My program will be, like I said, April 22nd. We will be bringing quality health care, and I say quality. The health care that you will receive is if you walk into a medical clinic with the EMR system, electronic medical record system. Labs will be being drawn. You'll be met at the front from the office staff, bring you back to see our licensed practitioner. You will have a primary care physician, and the kicker is no money will be expected at the end of the visit.
Tremendous.
So you will be able to get the quality health care without wondering, am I getting subpar help?
Right. Right. That's remarkable. What makes you do this?
As a doctor, you have to realize, we're here when we first signed up for med school to really help. However, once we get into it, we get these loans going and this and that, it comes into a business. We come into about making money. I felt really hypocritical being in that paradigm, being in that reality. So I had to not practice and really create a reality where individuals that need help the most would get it. Because one more bad decision, I would have been in poverty myself.
True.
And I would have been receiving subpar health care, and death would have been imminent.
How can people connect with you, get involved in the future?
You can check us out on Facebook, Instagram, and Twitter. On Facebook, you can find us at Atlanta Awareness for Homeless Health /A2H2. Instagram, you can find us at Changing Healthcare. And on Twitter, you can find us at A2H2 Hope.
All right, what about people that just got an email and a phone number?
My number is 404-561-3499. And you can email us at c.russell@a2h2hope.org.
All right, give out that phone number and email address again.
The number is 404-561-3499. And the email address is c.russell@a2h2hope.org.
Thank you, sir. We appreciate you, my friend.